Building Power, Women's Struggles to Situate Unpaid Care at the Center of Public Agendas. Deepta, thank you very much for having made your way out here. We are really, really happy you are with us and about the possibility of exchanging lessons learned on what it means to accompany women, grassroots women in different parts of the world, mainly of the global south, in pushing for more just care arrangements in the societies we live in. Thank you very much. Well, thank you also to everyone who is joining us online and here in person. The dynamic of the session has 4 moments. In the first moment, I will present our guest. In the second moment, I will share a few reflections about how care is being brought into public agendas by grassroots movements of women here in Latin America, what the lights, what the shadows, what the also the huge challenges are in this context, to build a bridge to what Deepta will be telling us and the context she will be talking out of. And then we will listen to Deepta with a keynote lecture. That will be the second big moment of our conversation today. Afterwards, we'll engage in a short dialogue where I will ask Deepta a few questions, and we will open then in the fourth moment for dialogue with everyone who is here and present in person, and also all the persons who are on Zoom who registered for this event. So that is the 4 steps we will be walking, and then I will present our guest. Professor Deepta Chopra is a research fellow at the Institute of Development Studies in Sussex, United Kingdom. She is a feminist social scientist with a focus on women's empowerment, politics of policy processes, and the role of women's movements in affecting policy change and countering backlash. Her research interests focus on privileging the voices of women and girls and examining their struggles for empowerment and core links with their paid work and unpaid work in examining the struggles for empowerment, as well as the politics of how social protection policies are made and implemented. Deepta's recent work examines the strategies and mechanisms through which women's struggles in South Asia succeed in countering backlash. Deepta is an expert on mixed methods, research design, and qualitative methodologies, and aligns herself closely with issues of power and participation, citizen engagement, and governance. My name is Jana Vasil'eva. I am a doctorate researcher here at Oxfam, here at FLACSO, Mexico, and I will be moderating this event. We will be establishing a dialogue with Deepta. Both of us work with women's movements in different parts of the world. In my case, I work with unpaid care workers who are organizing a grassroots effort, Yo Cuido, which unites unpaid caregivers who work in full-time in Mexico, in 14 states of Mexico, Chile, Argentina, and Peru. So this is what we will be weaving our dialogue around. Also, the dialogue is in English, since that is the language of Deepta, but during the part where we will engage in a conversation with all the persons who are participating online and here in person, please also feel free to make your comments in Spanish, to ask in Spanish, and I will be glad to translate. For the persons who are here with us, please also feel free. There's coffee, there's cookies. Feel free to get up whenever you feel like it. So with these organizational aspects put into place, let's dive into the theme that we will be speaking about. Both of us engage in supporting women's movements, women's organizational efforts, who or explicitly organize and push for care policies in the context where they live, or who organize around other deep issues, deep problems in their lives, and where care step by step has emerged also as an important issue to work on collectively. These efforts are full of lights and shadows. Deepta will tell us about the lights and shadows of organizing with women in South Asia. But before that, I would like also to share a little bit out of the Latin American context so that we can establish a bridge. So number one, the first aspect I would like to share, that as in many parts of the world, also in the Latin American context, the coronavirus pandemic has brought very clearly into light that care sustains life, and that the way care is organized is also a deep pillar of social inequalities, of gender-based inequalities, of class-based inequalities. And at the same time, this also catalyzed efforts around pushing for integral care policies in this region. These efforts did not emerge in these contexts. It is the result of long-standing grassroots organizing efforts of women's organizations, of feminist movements, but also within academics, and also of women mainly within the state, who have been pushing to situate care in the public agenda. And this has awoken many lines of work, many practices, many lines of action. It has brought into practice, for example, very fragmented but still care licenses for the persons who do paid work and seek for ways to conciliate their paid work with their tremendous unpaid work care duties. It has also made possible that there's each time more infrastructure for indirect care. So let's say running water, for example, to reduce care times, and many other aspects. In the last years, what this agenda has brought into light is pushing for integral care systems. And these integral care systems really seek to reorganize the way we live care day by day through public policy, but also through making care part of the agendas within wider social movements, within social organizations, and all institutions really of society. So that is the first point of condensation that has been brought much more clear into lived reality within the Latin American region due to the coronavirus pandemic. Also, a second strand, parallelly to these often very fragmented, sometimes even contradictory efforts that I have mentioned. In some countries of the Latin American region, there are also important efforts to inscribe the human right to care as a universal right at constitutional level, at national levels, but also at local levels. This includes also Mexico, where we are today. And This line of efforts sets an important milestone by way of a process that was impulsed by the government of Argentina in January 2023. The government of Argentina presented a request of an advisory opinion before the Inter-American Court for Human Rights about the scope, the content, and also the interdependence of the right to care with other fundamental human rights. And the Inter-American Court has set a period for receiving opinions from different actors of the Latin American region, from national governments, from local governments, but also from civil society, from social movements, and from the academic sphere. And there was a huge resonance around this consultation. 7 national governments, the government of Ecuador, of Costa Rica, Panama, Chile, Paraguay, Colombia, and Mexico presented reports. Also local entities, more than 30 academic institutions from different countries of the region, and more than 50 non-governmental organizations. So this process, more than being just a result, which is hugely important, the reports that were presented also showed that there's a huge capacity of coordination, a huge capacity of coordination within the feminist movement that is present within all these spheres. The argumentation in these reports had definitely a feminist stance and was pushing for a deep reorganization of care within the society. So all these actors met in March, 1 month ago, actually, really recently. This is also why I'm bringing up the conversation. It is one of the most important milestones lately. And the horizon here is to create public agendas around care that aim at transforming the conceptualization of the relationship between the state, between the society, and also the economy, but also a deep change in the subjectivities and emotional lives of everyone. And the third milestone that has been brought into light and catalyzed maybe by the pandemic is that we are seeing that even though all these efforts are crucial and that there are many actors coming along on the agenda, there are also many fields of tension and risks. And one of the fields of tension is that even though these efforts are widening, they still remain mostly within an elite and an agenda that does not permeate yet into wider circles. And it is definitely something that needs to happen if we want to push for structural change in the social organization of care. So when we speak about the social organization of care, yes, we speak about gender norms, but we also speak about class-based and implicitly racist assumptions about whose life matters, whose life are worth being taken care of, about extractive mindsets that prioritize growth for a few at the expense of the majority, and many other complex issues that are deeply internalized and normalized in everyday practice. So as the efforts to reorganize how we care in society begin to seek transformative public policy, at the same time, the plural needs, the worldviews, experience, and knowledge of wide groups of the population of the Latin American region, which is also a multicultural context, are mostly peripheralized in public debate, but also within academic spaces and in social wider debates. This implies especially full-time unpaid caregivers and women who organize at grassroots levels and often have really, really huge workloads and live in time poverty. And at the same time, these are the actors who sustain care in these societies and whose everyday lives, because of how our societies care currently, are marked by physical and emotional isolation as well as monetary and time poverty. All this puts at risk the effectiveness of strategies against the manifold forms of structural violence that arise from the current social organization of care in the region, which is also fraught by very deep inequalities. It is said to be the most unequal region in the world. And so we are in a really important historical moment in which care is moving with strength into public debate within the Latin American region. It is an opportunity to build wider demands and also critical mass to sustain the efforts on the long term that definitely are needed. And this is very important, building this critical mass, managing that the agenda can permeate into wider circles, also in the face of conservative forces that in different countries in the region are pushing back efforts around reproductive and sexual rights and promote values which impede new collective arrangements of care. And this pushback or backlash, as Deepta will explain in a moment, is not only a moral agenda, but also economic interest in order to maintain regimes that propitiate the rollback of the state and extract care to sustain a logic of growth that functionalizes all forms of life and nature. So that is, in a very resumed manner and very broad strokes, surely quite simplified because of that, the context, the moment where the Latin American region is right now at, in terms of situating care at the center of the public debate. And now we would really, really like to listen to Deepta share from a whole other context, another global south in this world. Thank you.
Thanks so much, Jana. And I'm really, really grateful and pleased that I'm here and we're having this conversation. Jana and I've talked a little bit about like how this is going to go. And I just wanted to say that the cross learning that we're hoping that will happen and the cross fertilization of ideas between what has been happening in Latin America is very advanced, I should say, from the context that I work in, which is in Southeast Asia and South Asia. So, as Jana said, I'm a research fellow at the Institute of Development Studies, and I also lead a project called Sustaining Power for Women's Rights, and that's the logo here that is there. And so that's one thing, but also just wanted to say a big thank you to UN SCAP, who have facilitated my work in Southeast Asia, and I will be drawing some lessons from there as well as from the super project, but also from a previous project that I did in 4 countries: India, Nepal, Tanzania, and Rwanda, called GROW, which IDRC was funding, which is Growth of Economic Opportunities for Women. So I'll be drawing from all of these sort of contexts to really think about how to situate unpaid care at the center of public policy agendas. But I thought that it'll be really nice to kind of just have a common understanding of what care is. And so, we, we define or conceptualize care as a set of activities that meet the material and or the developmental, emotional, and spiritual needs of other people through direct personal relationships. So it's really important to stress that direct personal relationships, which then in turn cause also the isolation. And because it's also like it's a it's not easy. This is a big sphere of activities. But I think that the fundamental premise that we are operating in, and I think there's agreement across all regions, is that care activities are care is a good thing. Fundamentally, care is the thing that underlies all. It's the cornerstone of all human activity, and especially of development and growth. And like you say, that it has these aspects. So the care economy does have different aspects. It can be paid or unpaid. It can be, so it's kind of like it's about having a necessary element of human survival, of welfare, and of economic stability. But I think that it also can be conceptualized as direct care, which is like caring for the sick, the elderly, children, domestic tasks like cooking, cleaning, collecting firewood and water. But it also can be performed in the paid labor market as occupations centered on healthcare, on education, on housekeeping, but also as in the unpaid domains of the home, of voluntary work, domestic workers. So these are all examples of nurses. These are examples of care which happens in indirectly. And like Anna said, like globally, there has been a lot of recognition of the importance of the care agenda, and it has been well recognized that the advancement of gender equality is necessary to advance the SDGs. But then SDG 5.4 is specifically about calling on member states to recognize and value unpaid care and domestic work. And I think that that's something that is really, really important for us to foreground, that there is a global agreement about the importance of unpaid care, which helps gender equality, which helps the achievement of SDGs. Now we know that women perform a disproportionately large amount of time to unpaid care and domestic duties, but also that migrant and domestic workers also shoulder this disproportionate share of formal and informal care responsibilities, and provide crucial support to household and communities. And these migrant workers can be both at like from the local levels to like cities, so rural to urban, or rural to rural, or other sorts of like in-country migration patterns, but also in terms of looking at international migration. And because of this disproportionate amount of time, it this aspect of the social organization of care really limits women's economic empowerment, and thus hinders their development and increases gender inequality. We did a study in Asia and Pacific on unpaid care and domestic work, and we found that in Asia and Pacific, the time that women spend is the highest on paid and unpaid care, is the highest among all of the world's regions. So it's a really sort of like women, an average, spend up to 11 hours a day carrying out paid and unpaid care work, which is 4.1 times more than men in this region. And also, if we look at reports, and people have started estimating the value of this, it's like an estimated 3.8 trillion US dollars could be added to the economy if unpaid care work was added into the GDP, just from the Asia and Pacific. So it's massive. Um, and we also know that why is this unpaid care work done mostly by women is because of existing gender norms, which inform the very division of responsibility. And it's almost like it's informed by ideologies of what it means to be a man and what it means to be a woman, so what it means to be male and female. So these are these very deeply embedded societal assumptions, and they're very sticky. They're very hard to change, very hard to move these gender norms. And of course, the effect, like we said, like I just wanted to give some numbers from the ASEAN region, where the gender effects of disproportionate care falling on women. The ASEAN region led to a reduced labor force participation, uneven access to care infrastructure, which was really intensified during the COVID crisis, mental and physical depletion for both them and their families, and also they're facing adverse effects of climate change and other disasters, which are exacerbated because of this disproportionate burden. And like you said, there are of course intersectional markers. So it's not just about being a woman, but also being a particular race, a particular class, ethnicity, and also disability, which exacerbate these negative effects of this disproportionate burden of unpaid care. Um, and this is the data from these four countries that I was talking about: India, Nepal, Rwanda, and Tanzania. And here we see how much uh, household task, which is the gray uh, um, uh, bar on the gray color on the bars, and we see how much there is the household tasks take up such a huge proportion of time on women, but whereas the direct care is actually quite small. That's the orange. It's quite small, and on first glance you would say, oh, okay, now blue, they know women are sleeping enough. But actually, when we delved into the data, we found that this sleep was very broken. So it was like it's not, this is the total amount. Like, women will go to sleep at some point, but they'll get up to, like, care for the sick, get up to fill water, get up to tend to the children, to the baby. So there is quite a lot of aspects of sleep. And and we also found a lot of multitasking amongst women. And this really, the fact that they are doing both paid work and unpaid care work. And this study was done with low income families where paid work was not an option, it was a compulsory thing. So women had to go out to work, but they also had to take care of the family and do household tasks. And we found that that one, women talked about time poverty very much. They also talked about stretching time, and this was a very interesting concept. They said, we stretch time. And I was like, well, how do you do that? So, they wake up early, they sleep late, they kind of sort of like, stretch, and sometimes, like, they sleep and then they get up and do some things and then go back to sleep. So they're really like stretching their physical and mental capacities. And this has led to emotional fatigue, guilt about burdening children, especially older girls, lack of adequate rest and leisure, which shows on their bodies and their minds. And we did, this figure is of a body mapping where women are showing the effects of both paid work and care work on their bodies. And and we found all sorts of health issues, from problems with hands, eyes, because of the smoke, lungs, but also serious issues like uterine prolapse. In Nepal, we found that lots of health issues. And we also found seasonal variations, both during harvesting season, but also during festivals, when there's like guests coming, and like there is a lot of work to be done at home, etc. And this is a quote that I thought would be very illustrative of what I'm talking about, which is that in Tanzania, the woman said, it's so tiresome. I'm not able to do my work well because of housework, but I also have less time for my children because I'm obligated to do both work in order to support my family. So she's kind of like stretched in both directions, both of, like, looking at paid work. She can't do it well because she's so tired about doing the housework, and housework she can't concentrate more because she has to go out to work. So it's, it was really instrumental. And I think the challenge in the Asia and Pacific is really, and probably the world over, probably, and also in Latin America, is to move this needle from like welfare regimes where the state provides, certain things as a handout, to actually having caring regimes. And most of this, like, if we are to build these systems, a systemic approach to care, like Latin America is doing, we need to think about who cares. So who is this person who's caring? And this is also really about, like, looking at the intersectional aspects of care and the relationship of this person, to the recipient of care. And whether there is a spread of care within the household or not. Who pays? So who pays for this care work? So is it completely unpaid, and therefore, like, but who pays in terms of not just the financing, but also who bears the costs of care? And like, is this cost like being borne by women's bodies, right? So it's kind of like, who pays in terms of both the financing and of care services, but also how women really bear the costs, and where care is provided. Is it provided institutionally? Is it individualized? Is it collectivized? So these are really important questions to be considered. And really, we know that public policies and public agendas can mold the way in which care is provided and funded, and determine, how care is provided, for whom care is not provided, and by whom, and therefore influencing these agendas is really critical. So I now come to the second part of my presentation, which is about, so we know the problem, we need to influence public policies, but how does one do that? Now, different um, people, different groups have taken different approaches. And one is, of course, the human rights approach that the government of Argentina is also recognized, but also in terms of looking at, the UN OHCR, which has recognized that, and passed a recent resolution on care and support, and recognizing and really addressing care and support, also for recognizing the care and support that disabled people, or people with disability need. So this is another approach that, a lot of organizations, mainly NGOs, have done. This is a poster from ActionAid where, it visibilizes what women do, like lots of, and there's lots of work being done about that. But there's also work being done about fitting care into the current neoliberal economic paradigm by giving it a monetary value. Most of it is done by estimating in terms of time use surveys, but also in terms of multiplier effects, and saying that, okay, if you invest in paid care as a sector, then it creates these many jobs. And we've seen, actually, Hannah and Susan Himmelweit have written published this article on care-led recovery, which has a superior employment potential. And the Levi Institute of Economics, which is based in the US, has also done a lot of work on the multiplier effects of care. Now, my question obviously is that, of course, this is, like you say, it's a neoliberal paradigm. So the idea is to extract, the surplus value of this unpaid care. So is it really useful, or could it be counterproductive? And there are different ways of like thinking about it, but it's really important that one thinks about this in terms of public policy influencing. Is that, is it really important to monetize care, because, but the problem being that then only that is monetized is valued, and that might be a counterproductive argument. But then it's also useful, especially to kind of like show and evidence the amount of care. But I think that I'm pretty sure, and a lot of countries in the Asia and Pacific are now doing time use surveys, and I think that there's a lot of resources that are going into that, which could actually be usefully deployed into actual public policies rather than doing time use surveys. Because the world over, we know that care that women are doing care work. So what is it that we need to prove still to policymakers? And I think that that burden of proof, when it kind of like falls, it's kind of like a little bit of a, you could kind of think about it as like something that is an unnecessary question, but delays public policy intervention by the time that time use data is used. But it can also be very useful in directing specific interventions to specific communities, saying, okay, here there is more time being spent on water, here there's more time spent on gathering fuel wood, here there's a need for childcare. Yes, like so. But I think that it can be useful, but at a national level, it becomes too much. And India has just published a massive time use data, which shows that women are doing 9 times the amount of work that men are doing. So most places we're showing the same sort of like result. It's not a new thing. The other aspect in terms of influencing public policymakers is to do research reports, and we've done with SCAP, as I said earlier, some reports on like not only kind of like what's happened after COVID in the Asia and Pacific, but specifically how to address this issue in the ASEAN region, because the ASEAN region was very interested. And then we also did a primer, which is kind of like, how do you invest in the care economy? And we are now in the process of making some more practical aspects, which I'll come to in a minute. Popular communications. This one is from Oxfam. So this like talks about like the global chain of care that's happening, and like, and she says, I'll be back in a few years, and so it's talking about migrant women as care workers. And this was a viral email that was sent around, and again it helps in like changing public perception of the fact that all care workers, whether paid or unpaid, have rights, and so these have been very useful. We've I've done these two animations, and if there's time, I'd really love to show them later, about care and how public policy, what is the problem, and how what could have been the solution to public policy. So these also help policymakers get on board, because policymakers don't have the time to read these lengthy research reports, right? They need something quick, and they need something that is a policy brief, or a one pager, or a quick animation, a quick so that they can kind of understand what the issue is and get on board. And then the detail, of course, the devil lies in the detail, but it's also really important to convince policymakers that care is an important issue that is on investment. At least in the Asia Pacific region, it's not yet happened, and the South Asia region certainly not. Um, Now, coming to a framework that has been used for public policy, and this has been used widely globally also in Latin America, is Professor Diane Elson's approach of the 3R framework, where she says that we need to recognize care and care work. We need to reduce the time that is taken in care work by reducing the drudgery, the difficult and inefficient tasks of care. And we need to redistribute this responsibility of care more equitably, not only from women to men, but also from families to the state or the employers. These 3Rs need to be a precondition for achieving women's political, social, and economic empowerment, and to address poverty and inequality. Now, then Oxfam was the first one talking about representation of carers in decision making, and then the ILO added another R, which is reward for carers, and this is about mainly about paid care and paid care workers, including domestic workers and nurses, and fixing sort of like a living wage, etc. And that's what ILO has been stressing. So this is sort of like this is the theoretical approach that has been used. However, what we found is that it's really hard to put this into public policy making, right? So what does a policymaker do actually? So I think that my colleague Meenakshi Krishnan, who's finishing a PhD with me, and I basically kind of thought about what we could do to reframe this conceptual framework to actually a practical aspect. And we also thought that as we said that we wanted to establish that care is not a burden in itself, that care is a good thing. So care is a foundational element of our society, but we also wanted to redirect the current attention of the triple R framework, or even the 4 or 5 R framework, on recognition, redistribution, and reduction of the quantity of care to actually what is the quality of care. So we wanted to talk about um, gender transformative outcomes in terms of looking at the strategic needs of women, and to address both the needs of care providers and care recipients, right? So the right to care is the right of care is both of the right to care without being exploited for the caregivers, but also then the right to receive quality care, rather than just substandard sort of like let's say childcare centers which don't really work. I mean like we know that we're not going to send our children to care settings where it's not good quality. So, and that goes with everyone, right? So it's about addressing both the needs of care providers and care receivers, and taking care as integral. And I'll talk a little bit about this complex diagram, but we kind of thought about this as this is the systemic approach that we're trying to take in the Asia and Pacific region, which is building on some normative care principles, some policy actions, and some levers of change to really come to a transformative outcome. And I just wanted to take you through each of these in terms of like looking at what these are. So in terms of making care foundational, we've differentiated between care sensitive measures, which are specifically about recognizing, reducing, and redistributing this care work, to gender differentiated measures, which are explicitly responding to women's needs and perhaps directly targeting women as direct beneficiaries, but may or may not take care into account. So we need something that is not just gender differentiated or gender sensitive, gender integral. We actually need measures that are care integral, which are care sensitive, that take into account this disproportionate amount of care that women do. And in this, we thought that we'd look at the model frame. We thought, okay, how can policymakers do this, right? Because this is all very sort of like conceptual, and as I said, policymakers need concrete instruments. So we said, okay, we'll build a model framework for action which has these four elements of a political economy of what is going on of care, like who is responsible, etc. Some policy categories, some levers of change, and some normative principles. Again, drawing from that, so we have the seven. So why the 747 is because we have seven normative principles, four policy categories, and seven levers of change. And these are the policy categories of care that I think many governments in Latin America are already thinking about. But in but from what the little I've read, and we can talk about this more, I think the emphasis has been on care infrastructure, which is like transport and fuel, and like you said, water provision, etc., and care services in terms of like childcare services and care for persons who are sick, etc. But I think that and some on care related social protection like cash transfers, food vouchers, etc. I'm not clear whether there are employment related care policies that are being thought of as part of this care integral system, which is sort of like flexible working arrangements, shared parental leaves, on site crash facilities, things like that. I don't know. I mean, I'd love to know more, but I think that so these are four categories of care policies that go together. It's not like one policy, it's like a four categories, and policymakers can come into any of these policies to start with. But if we are to make a care system, then we need to integrate all of these policies into that system. And in judging the political economy of care, we need to think about not only the relevant actors, but what are the formal policies and laws that already exist, and what are the institutional mechanisms. And this gives us the sort of like the room to maneuver in terms of what is it that exists, what is it that doesn't exist, how can we change existing policies, or how do we really need to have new policies. And also then the informal norms that exist in any country on gender and care, and these are informal institutions that, so we need to kind of like look at these, and then think about some levers of change. And these are, of course, financing is needed because it's government, budgeting, because you can't get these policies and instruments in place without budgets. We need norm change. We've talked about like how sticky these norm changes are, so we need advocacy for that. Um, we need to represent these intersectional perspectives, so it's not just about women from a particular class or race, but actually it takes into account the variety of needs of different women placed in different social and economic uh, aspects in the in a country or in an area. We need gender disaggregated data, but also care disaggregated data. We need those legislative and regulatory frameworks, but on the whole, what completes this cycle really is a whole of government approach. Because without a whole of government approach, basically this means that care policies can't just be, or care systems can't just be headed by the women's ministry, right? Because it's not just a women's issue, this is a societal issue. So we're thinking that that's really important. Coming then to the normative principles. And these are again the principles that we want to instill, and we want to assess the extent to which in any country or any particular region these norms or these principles exist, or if they don't, what can we do to embed them. And we need to have the idea of care as a public good. So it's not just something that can be provided in private by households. It has to be a universal provision so that it doesn't leave out anyone. But it also has to be of good quality, as I said, which then brings us to the principle of availability. Because like, if it cannot be universal if it isn't available and accessible, in terms of both being like physically accessible but also financially accessible in terms of affordability. And then we need to also think about, as I said, the rights of the care providers. So who provides care? So decent work for caregivers, paid caregivers, as well as inclusivity and integration. So we can't just say, oh, like, we can't kind of make sort of like, oh, these are the poor people who need care, and therefore, like, so there shouldn't be that stigma attached to addressing or availing of care services. Um, so all of these bring like an action plan, sort of like, we're still at the stage of action planning for many countries, but this is sort of like the way in which we set out this, saying that, okay, so once we've got these aspects in place, then the plan of implementation is really to think about, firstly, the line ministry, to identify which area they want to work in, whether it's like one of these four, which of those particular policy elements, has the political economy been assessed, identifying all relevant stakeholders, agreeing on normative principles, identifying care needs, conducting policy deliberations for each policy area, and developing a country action plan. Now, these are the first 7 stages that we have been able to do in some countries, especially in Cambodia and in Philippines. We've managed to get to the 7th stage. We are in the process of looking at now, how do policymakers really make that implementation plan and conform to international standards. We want to encourage the policymakers to invite comments from a larger population of civil society, women's groups, etc., to revise any policy design or implementation plan, to pilot and refine this design, to kind of actually detail out the action plan, make sure that you've got coordinating mechanisms, make sure you've got budgeting, make sure you're conducting awareness generation, as well as then monitoring and implementation, and then reviewing and feedbacking that into the policy design. So there's a long way to go for implementation yet in the Southeast and South Asia region, but we're getting somewhere. And so at the national level, what we've so far done is we've trained policymakers and provided technical support in Cambodia to actually develop a Cambodia framework of action containing an action plan. Um, we have provided technical advice at the municipal level to adopt certain ordinances on care in the Philippines. We are supporting in China the development of childcare policy in the context of declining fertility and population aging, and this is what we're doing through ADB China, because they are putting in the finances for this. We are in the process of advising and training policymakers and having a national care consultation in Lao PDR. And we will be advising care policymakers in Timor-Leste from this year onwards. So we're just starting on that process in 2024. So this is some progress that we've made at the national level, but we've also had a lot of challenges. And I think one of the main challenges has been the weak conceptual understanding, and which is why that technical support is so important, in terms of saying, okay, this is not just about childcare, it's actually, or elder care, it's much more than that. Um, we've we've had this issue of a concentration. So we've had very active, and I should say activist policymakers, bureaucrats, femocrats, that really are working with us on this issue. But most of this has been concentrated again in the women and child ministry of, Ministry of Women, ministry, or whatever it is, like, it's sort of. And this ministry, we know, has restricted power with line ministries to make policy changes, because it's the line ministries. It's the Ministry of Agriculture, the Ministry of Rural Development, the Ministry of Infrastructure. These are the ministries who are going to actually, Ministry of Education, for like, all of these are going to be the ministries. So concentrating that issue in the hands of policymakers really defies then the whole of government approach that we're trying to take. But that's a challenge. And also, we've seen in a lot of countries that, and it comes probably from the weak conceptual understanding, that it's become a lot, at least in the regions that I'm working, it's become from unpaid care and domestic work to childcare, or at best elder care. Like that's all that is being talked about. And some of it is also unfortunately problematic because of the idea that, of the Western world, and Western academics and feminists to actually say, oh, childcare is important, and a lot of money is going into childcare initiatives. The World Bank is doing pilot projects on childcare, so a lot of money from these Western hegemonic institutions is going in, which is define the understanding from the ground of these women. So I think, it's really important to understand that. But also, then there are national budgetary constraints. And I was in at CSW, the Commission for Status of Women in New York, a few weeks ago, and we, like there were two issues that were talked about. One, that there is so much more emphasis in care budgets on defense and on industry, and so much less on sort of education, healthcare, agriculture, infrastructure. The ministries that really need the money are starved of that finance because of this sort of like careless budget. But also, like the government of Kenya representative said, in a forum, she said that we're so busy repaying the debt for donor dependent country for us, that we are really struggling to find the budget for these care initiatives. So I think that there is something to be said about the debt repayment, and perhaps a cancellation of that debt, or something needs to be done at the global scale if we are to really think about these budgetary constraints. Um, but perhaps there's also a lack of examples, practical examples of where it has happened, especially innovative financing models, because policymakers are like scared, they're risk averse, and they're saying, well, actually, how do you know? And I think the modeling of the this is where the modeling of the, how much investment in childcare actually produces additional jobs for women, etc., is really useful. Uh, but I think we also need innovative financing models in terms of tax, and how we actually redirect that tax to care policies and care programs. Um, we've got, I mean, I'm really, as I said, I'm really grateful for this opportunity for cross learning. But I think that we are only starting to learn from each other, and I think that there's a limited cross learning avenues, which becomes a challenge. And then, of course, there's backlash. And this is where I now come to the third part of my presentation, where I'm going to talk about some backlash that we've faced, that women's groups have faced, but also really thinking about what is backlash first, right? So I think that, broadly speaking, we can think about backlash as a diffuse and powerful attack on the consensus on gender equality, which aims to firstly demonize and disempower those who seek to advance gender justice, which seek to revalorize traditional gender roles and stereotypes, and which co-opt existing processes and policies for gender and development. And COVID has only exacerbated not only existing gender inequalities, but also exacerbated the backlash, because it's kind of like, and it's provided an avenue. Interestingly, you said to me earlier that COVID has strengthened some of these policies, some of these aspects, because people could come together. Whereas actually what we found in South Asia and Southeast Asia is that COVID has actually been used as an excuse to like not organize, right? Or like not let other people organize these women's groups to be organized. So, and backlash plays out very differently. I think in Latin America and South America, the context is very much about anti-gender backlash, whereas in South Asia and Sub-Saharan Africa, I think it's about really like very different sort of like aspects, and the backlash is about putting care at the center, which has come from this neoliberal economic hegemony. Oh, this is how the system works. How can we pay unpaid workers, how if we pay them more, then where's the sort of like the exchange, etc. So it's really come from sort of like neoliberal economic hegemonic sources. It's also come from patriarchal conservative gender norms. South Asia specifically has incredibly bad um, what should I say, skewed gender norms, where it's a very patriarchal setup, where women's mobility is questioned, like for women to come out of the house is questioned, let alone participate in sort of like groups and collectives, and also some conservative groups have so the brotherhood, and they've said that, okay, like if women are so burdened with paid work and care work, women's role is in the household, so they should not do paid work. So it's kind of like like really entrenching those gender norms, rather than actually like and kind of saying that care is the responsibility of women. So that has been quite a strong backlash. And then of course there's been strategic ignorance, because we think that if policymakers were to recognize that care is a problem, they would have to completely reorganize their economic systems in order to take this into account. And that is something that is has not been done. But I think it's also been, like you said, like sort of like an elite led group of let's say feminists, women who themselves, at least in South Asia, have uh, they employ other women, and so it's not in their interests to recognize domestic workers, for example, or to recognize that that care is a problem. So I think that there has been a problem of elitism. um, and there have also been unconventional sources of backlash. So, political leaders, media, increasingly online backlash, so kind of like, having lots of different kind of like, bots and all sorts of things that have created this sort of backlash. Women's movements have themselves very different views on different issues, and they found it hard to sort of come together. And so these contestations are both issue based but also leadership based. Oh, like, I don't you know want to work with you because you work from a particular perspective or whatever. And then through donors, they've been really deprioritizing and agendas that may not be serving the interests of women. And I think the childcare example is one thing that is really problematic, because donors want to fund only childcare initiatives. And like, if you saw from my previous graph, women are spending such less time in direct care of children, that they are like, this is not an issue. We want other things. We want infrastructure. We want we want water, because you have to go out 2 hours for water collection. We want electricity, or we want gas connections, because we have to go out and collect firewood. So there's a lot of sort of like mis sort of like misjudgment of what actually women need in these aspects. And some of the emerging themes from work in South Asia has also been that care work in households is taking place, like we said, through these gender norms. But like you mentioned, is actually being used as restricting women's participation. So it's deliberately used to control their movement. You cannot go and organize. You cannot go out and do like this sort of like collective organizing, or be on Zoom for an hour, because who will feed the kids, and who will give hot water for the husband to have a shower, or all those things. Like, it's actually been used as a backlash. But I think there's been also glimmers of hope, like rays of sunshine, which have been there, which because collectivization has really kick-started processes of change in largest gender norms. And we see this, for example, and this is a photograph from the Punjab in India, where women farmers are collectivizing, and and women leaders are really uh, they are really leading processes of gender norm change, where men are doing some more cooking, and the redistribution of care work is a part of these larger processes of change. So there is, but they also recognize, and this is a quote from a woman farmer who I interviewed, which when she said, this is translated, of course, she said, it's a long way to equality. Say I have one son, one daughter. I would not tell my son to do anything, and I'll tell my daughter to learn housework, and she has to go to the in-laws house. So that's not fair, right? If I want to do justice to both, I should involve both of them in household. Equality will come through this root. The root is within women. They are the ones through whom care work is handed over to women. So therefore, we need to start somewhere to change the system, and this will happen at the household level. So she's saying that, unless we as women teach our both our children, like both our sons and daughters, to take care of, like, because it's hard to change gender norms at that sort of generation, but intergenerationally change can come. But obviously it's a long route. So and I think that really captures the sort of like the way in which care is being used, but also care is being used in feminist resistance as a strategy of organizing. And what has been shown by public protests, this is a picture from Shaheen Bagh, also in Delhi, in India. And this is a children's corner which was made spontaneously by women who were protesting against a policy change. They it was 100-day sit-in, like, so 100-day, 24 hours women were at this site through winter, and through the harsh sort of, like, through rain, everything. They were 24 hours sit-in, and they showed how public spaces of protest can coexist in conjunction with these private realm of women's everyday lives. They built a shared rotational space, so women would come and go according to that sort of, like, their care responsibilities. But also this led to a certain reorganizing of care. So the husband would go and collect the children, feed them, bath them. And they also showed that growing an ethos of care within women's struggles is really critical to building their power and sustaining their progress. Um, and that practices of care really help women's struggles to be together, because despite backlash, because it's kind of like a space where women can emotionally share that sort of like pain, but also practically and logistically share for each other. So the ethos of care as a strategy has come up very strongly in South Asia, in the 16 struggles that I'm working with in Super. And this building of caring movements is something that I think is an emerging sort of theme that we really need to talk about. So finally, lessons learned. We know that time use surveys and other quantitative data are useful, but we also really need deep qualitative profiles of women's experiences to show the complexity of the issue, especially to donors and other actors who think that care is very simple and like just happens because women can do it. Reports, of course, highlight and raise the profile of the issue and shine the spotlight on the relevant policy frameworks in the country. But there are also ways of, like, policy briefs, I should have added that, animations and viral communications, which are very effective in terms of messaging. So both conceptual and practical reframing is useful. And the model framework of action that we've developed based on the triple R framework gives a number of entry points to policymakers. But we also need local ownership, because we can make a model framework, but it has to be adopted and be really kind of sort of owned by country policymakers, whether they're at the national level, local level, regional level. Uh, but we also need to recognize that care and domestic work can be used and might be used by others as a backlash strategy. So we need to be prepared for that. And we need to grow an ethos of care and solidarity, which really helps in building power within women's movements, and therefore really creates what we call caring movements, right? So thank you so much for your listening. I'm sure I've gone way over time. I'm really sorry for that. But yeah, I mean, I'd really welcome questions and answers, but it would be really good also to have a conversation thinking about like what you think is common between Latin America and these regions that I worked in, mainly South Asia and Sub-Saharan Africa. So yeah, over to you, Anna.
Deepta, thank you so much for sharing in so little time so much of the work that you are doing collectively with many, many actors in the context where you work in. I think we can do this reflection that you are inviting us to in dialogue with what is happening in the Latin American context together. We are many people here also. I just would like to highlight maybe 2 points of which you are mentioning. First of all, saying that what you are sharing with us in terms of the conceptual organization and the roots of work you are proposing and working together with practitioners in different spheres definitely is really useful. There's always the huge challenge when we are having a dialogue with government officials who are actually very open to listen and to collaborate, to put into clear words and clear proposals uh, something that can also be taken into public policy, is exactly because sometimes the worlds of references are so different. So that is really, really useful. And I think that is also something that we can maybe keep on having a dialogue on to delve deeper into this cross-fertilization that we were seeking and looking for as we organize this dialogue. Something I want to highlight is that you are mentioning that, of course, there's always this huge challenge of budget, and everywhere we have this dialogue on care policies and reorganizing care. There's this argument, yes, but there's no money. There's no money for care. So something that we are seeing in the Mexican context specifically, because Mexico really is living deep violence, structural violence, in terms of gender-based violence. There's a hard nucleus of violence against women and girls that has nothing to do uh, with more recent waves of violence, of organized crime, and of the territory being debated, and um, different forms of violence that arise from there. So an argument that has been working for us and that needs to be still put into numbers is that care, the lack of care, has a huge social cost in terms of violence, the violence we are living in across Latin American societies, and specifically in a society such as Mexico. So an argument that actually has come from the academic sphere, and that also connects to a question I would like to ask you later on, is that Irene Cacique and Roberto Castro, who are two academics from the UNAM, which you have visited, they have showed evidence that within those households where care is lived in corresponsibility, the levels of violence go down really strongly. So sexual violence goes down, the risk of sexual violence goes down by 70%, physical violence also around 60%. So that is evidence that has worked. And I think that is something really needed, because it shows us not how do we put care, how do we squeeze care into what we do, no, but where are these points where we can see the transformative power of situating care at the center of our public, but not only public, common life also. No, so that is one point. And the second point, you were asking about labor, and in what sense there's also care policies that are proposed within the labor regulations, etc. This is a point that I think is really important that we discuss here, because we are in a conversation around care policies and struggles for care in the global south. in the context of the Latin American societies, more than 50% of the population, for example, work in informal sectors. So care licenses within the traditional mindset do not apply at all. No, so there's a huge divide again. No, like very elite conversations and conversations that do not apply to the huge majority within the region. And something that I am also seeing, again, connecting with what you are saying, no, where are these points where the care agenda can be transformative, no, where do we channel our energy to? I think that conciliation definitely is really an important way to go, but that cannot be the only agenda. We also need to ask what sorts of skills, what sorts of capacities are valued, no. So, for example, in traditional mindsets, when persons are out of the labor market for a while because they have huge care and responsibilities, this is seen as lost time, not as time where persons build capacity. So I do think that there's an important argument to build, and this also brings care out of a corner where care is just something, yeah, it's an additional element that we need to work on to improve a little bit gender equality and to make possible better childcare, as you were saying. That is a theme that is often retaken. This is a very functional way of framing it, because of course childcare, it is really important. We are talking about lives, but out of economist mindsets, childcare is also providing future human capital, no. So I do think that these are arguments that we need to explore. And in the spaces where we have been mentioning violence and also changing the mindset around how to bring care into the labor rights agenda, this is something that creates resonance, and that is something maybe that I would like to share from the Latin American context before opening to discussion. But before that, I would like to ask you two questions that connect very much to a point you're making, and I think it is really, really important between many points important points you are making. You were saying, you were asking, how strategic is it to channel and to invest so much energy and also all kinds of resources, not only monetary resources, and generating every time more evidence, for example, in terms of time use and of the economic value of care. We already know that this is important, no? So something I would like to ask you is, from your work and the context you work in, what are the challenges and specifically the possible strategies for the representation of unpaid care workers, plural needs, but also worldviews in policy design and implementation on the one hand, because I think that is something we are not exploring enough. We are channeling all our efforts into talking the language of power, of the status quo. And what you were saying about the protest and the political force of bringing care into the collective space is another language, and is another language that needs to be strengthened. So that is something I would like to ask you. And exactly here, what is the role of research? We are in an academic institution, in contributing to the development of care integral economies out of women's power struggles.
Thanks, Jana, for those reflections. And yes, absolutely. And I think that it's really, really nice to kind of like hear of a different perspective of like not just the benefits that care might provide, but actually thinking about the what are the social costs, or even like in terms of violence or other aspects, that if care is not shared equitably. And I think that is something that is really, really interesting to me, because I don't know how much work there has been on the social costs of care, in terms of like the social costs of care not being provided, right? Of the lack of care. And I am not aware of studies, at least in like in South Asia, or Southeast Asia, or even Sub-Saharan Africa, that I can think of that are actually doing this. So I think if there's an evidence base of linking violence to care in such an explicit way, that's absolutely incredible. And I'm very pleased to know this is happening in Mexico, and that actually, that it has led to policymakers are listening to that. In Mexico, I know is really sort of trying to implement a care policy, or trying to actually pass a care policy, right? They're trying to design one. I think that was what I was told. So coming to strategies, mm, I think that, look, the challenges are many, and as I said, the challenge one of the challenges is to actually find time to organize, right? So now, we're asking women not only to do their care work, their paid work, but also to do political organizing. So I think that there is something there to be said about sort of social norms and norm change. And I think that what I would like to do is I would like to go back, and I had some slides for this. So if that's okay, I'll just quickly go through them. I think I'd like to go back to this, which is what Shara Razavi made a few years ago. And she said that these are the institutional sites of care provision, right? So one is the family or the household. So second is the not-for-profit or the community, right? Then there's markets, and then there's the state, like both federal and local. And she said that institutionally, that care should be provided, sorry, at these different levels. Now, care is not being provided at these different levels, and therefore at these different institutional spaces. And in fact, the challenge of the care provision is also, or the challenge, like you're saying, of like incorporating women's perspectives is also coming from these different institutional aspects. So for example, in terms of the family, like I said, mobility, use of care as a strategy is coming very much from the family, from other family members. And I think the strategies to work with the family would definitely be education, awareness generation. I think building allies with sympathetic men, but also intergenerationally, as that woman like mentioned, that we need to build allies which are intergenerationally. And then collective organizing in terms of not just one woman of this household, but actually maybe all women of the household. And like, so I think collectivizing within the household is really really important, because the challenge is coming from there. In terms of the community, of course, there are challenges again about kind of like, oh look, like, and we've heard this from very many women's movements that we work with in super. They kind of say, oh, like they'll kind of like say to the man, oh, your woman goes out, and or your girl goes out and spends 2 nights away, who knows what she's doing. And like, like a moral sort of reasoning of like, we should keep our women and girls inside the house, because if they go out, who knows what they're doing. And like the implication being that they are sexually active, or like like outside the household. And I think that there is a lot of sort of uh, what should I say, norms about that. So the challenge there of like, women collectivizing is very much coming from kind of this sort of like perspective. So I think again, awareness generation is very important. But I think working with religious leaders and local leaders to actually um, inform those sort of awareness generation strategies, and to take these religious leaders alongside is very important. Because because if a religious leader comes out and says that, oh, this is a, that we need to, like, that men need to help in something, it will really count. Because or that men and women are created equal, rather than saying that care is the responsibility of a woman. To reread some of those religious texts. And actually, a group in India called the Bharatiya Muslim Mahila Andolan, BMMA for short, has actually been working with religious leaders and rereading Islamic texts, and saying that actually in this there is a direct relationship between between care, distribution and the relationship with God. And I think that it's a really powerful message that is actually finding resonance with with the community. And I think that, I mean, and another aspect of like, so like we cannot just have one feminist aspect, right? So this is Islamic feminism, then there's Dalit feminism in India, then there's so all of these intersectional markers of race and class recast really need to be, so this rereading of religious texts is really important. Education and narrative building, again collective organizing. So because if all the women in the community are going for a training program which is overnight, then that's very different from like one or two, right? So there's strength in numbers. And again, building allies within the community, the youth groups especially, or other women's organizations, other communities, like so other local communities, and conversations around peace and harmony and justice are really important to counter that structural violence that care, that an unequal distribution of care can cause. And then there are interventions in conflict resolution processes that people have tried. So there's a lot of strategies that are coming out to work with the community, and these are all strategies that I haven't thought up. These are strategies that I've seen are the six. We work with 16 struggles in 4 countries. Sorry, I should have said that: India, Nepal, Bangladesh, and Pakistan. Each country has 4 struggles. We work with 16 struggles, and these are the strategies that are coming out of that. In terms of market paradigms, so now we need to work within the market paradigms. We also need to challenge some of those market paradigms, right? So collective bargaining really helps. Again, collective organizing, um, mm, because if like, so if all domestic workers in the region, and this has happened in Delhi in India with one of our movements, where they have actually set out a sort of like a wage list, so a rate list. So like saying, okay, cleaning, one room would cost this much, cleaning at the balcony will cost this much. Like they've really itemized this thing, and they all have collectivized, and that really helps. Because an individual collectivization with an employer saying, oh, you need to pay me more, is not going to work as well as this collective bargaining. But also building allies with employer organizations, working with trade unions, or setting up women's unions, so important. Because trade unions traditionally don't take women into account, but definitely don't take women in terms of care work into account. So care work is done within the family. What does trade unions have to do with it? I think that sort of strengthening of market linkages needs to be done. And building alliances across class and gender based movements, really really important. Because we do know that there are different classes of women, and that care responsibilities fall very differently to these different classes. And I think it's really important to build those alliances, and then working with donors to actually insist on international systems or international standards, you know, in terms of, this much care work, this much, whatever, like paid work, etc., is really important. Then, of course, the state policymakers. We need to influence public policy, like you said, right? And I think that there are a number of strategies that our movements are using. There are the traditional antagonizing strategies, which are the escalate, the strategy, have a rally, have a march, demonstrations. These are flashpoints, right? But then there's also working in partnership with with governments. So like, and having coordination. But then in Nepal, we've seen women's movements, women's struggles actually like stand for elections. Even in India, we've seen that. So incorporation within and working from within. So really kind of backstage support, for example, in electoral politics, is something that we found both in Nepal and India. Advocacy, of course, against things like child marriage or polygamy, which have direct implications on care, right? Child marriage specifically, really important aspects on implications on care. Understanding a legal perspective on what can happen in terms of the practice of justice and lobbying and advocacy. Persuasion and praise has helped a lot. Oh, you've done such good work in this area. We really want to replicate this in other areas. We were wondering if we can also have this and that. So working, but also working with champions, because there are champions within judiciary, within parliaments, within bureaucracy, um, and building alliances. Media is really really important, because you can build strategic sort of like force in terms of saying that you have to do this. So not in this struggle, but like in the making. So this is what I did for my PhD, in the making of this employment guarantee act that the had. There was so much public protest that they had to adopt the act, and b, they had to put a crash facility on each work site as a provision in the policy, because there was so much sort of outrage about how how would children be playing in the construction sites on sand and things. So I think these are some of the strategies that we found that are working, but there are sorry, there are other strategies, like I said, using care as a strategy in terms of women's leadership building and peer-to-peer support, psychosocial support, very important, of mental health of women activists, because it's a lot of work, to actually think about that. And alliances with NGOs, working with male allies, lobbying, evidence generation. You asked the role of research. I think the role of research is really about both evidence generation but also documentation. And what we are using is a process of sort of collective accompaniment with these women's movements. So as I was telling you before, when we were coming here, we are working with theater based methods. So what we're doing is we are there's a pedagogy called Theater of the Oppressed, which in fact Paulo Freire in Brazil did, and this is like being transported all the way to South Asia, and we basically work with women's movements and help them understand what is going on. And like, so we've got this, like entry points at every sort of like 3 months. We have a conversation with them, we have workshops, and where women are able to sort of like collectively analyze. So providing that space for analysis is really important for researchers to create, rather than just sort of extraction, and documentation, because women's struggles typically don't have the capacity to document. And so yeah, and the use of art and humor, all of these things are strategies that these women's groups are adopting. So these are some really important aspects that I'd like to highlight from what I've seen so far. But it's early stages. We've got a lot of data. We're still at the analysis stage. We still don't have papers or like things to share. We have a website. We have that's really amazing. We've got blogs there, and if anybody is interested, I can put the link in the chat and say it around. It's www.s the swp no yes supwr.org. So www.supwr.org. So that's where we're yeah. So we're still in the process of like doing all of this, sort of like thinking through what are the strategies, and also what is the role of research. What do we do? But I feel that the role of research is much more than just extractive research. We have to accompany these activists. We have to become researcher activists ourselves. So yeah, thank you.
Thank you so much, Deepta. On that note, that you are closing with before opening space for questions and comments, I do think that we have a long way to go in all academic institutions, of realizing that everything we do is political. So we can or reinforce the status quo or support manifold efforts to push for more just arrangements of care. And definitely that is not an easy road, not a clear road, but I do think that it is so important to have very explicit conversations about that. So thank you so much for sharing this very diverse mosaic of strategies. And we have started a little bit late because of a little bit of technical issues. So now we have some time for questions, for comments, whatever you'd like to share. If you would like also to share something from your work, And of course, if you want to make questions with this huge opportunity of learning from women who organize in a completely other part of the world, you're very welcome to do so. Please raise your hand. Pueden levantar su mano, les pasamos el micrófono si tienen cualquier comentario. And also, everyone who is on Zoom is very welcome to make questions. We can also put the audio so that we can hear you. So everyone is welcome. Claro.
Bueno, mi nombre es Mónica Cedeño, investigo, soy licenciada en Comunicación y Periodismo, investigo sobre las políticas, la Ley Nacional de Cuidados que están impulsando. Y bueno, con respecto a esto, veo como qué tan significativo, o bueno, qué tanto análisis o qué tanto avance llevan con respecto a el perfil que cada mujer tenemos en aspectos de cuidado. ¿A qué me refiero? No es lo mismo las mujeres o el sector de mujeres que a lo mejor nos dedicamos al cuidado materno, no sé, por ejemplo, con una licenciatura, a el cuidado materno que desarrollan personas que además trabajan y cuidan a sus hijos al mismo tiempo, por ejemplo. Si hay si se han creado como tipo de perfiles, si a su vez también se ha tomado cuenta el hecho de que cada mujer, o sea, las mujeres que nos dedicamos al cuidado materno, también muchas de nosotras estamos o tomamos la actividad como con el aspecto, sí, por decisión personal, también por decisión amorosa, digámoslo así. ¿A qué me refiero en este sentido? Me refiero a que he visto dentro de la Ley Nacional de Cuidado, bueno, de la ley que se proyecta que, por ejemplo, prevén mucho que los cuidados se destinen al Estado, cuando las mujeres sí también nos preocupamos porque no nada más sea el cuidado puede ser de nuestros hijos, de nuestros padres y todo, pero garantizando esta parte de amor, de solidaridad, de no desplazar el hecho de que, bueno, a quién se lo doy, o se lo llevo a una guardería, esto porque también el Estado ha sido han habido muchas evidencias de que el Estado no proporciona esta parte de calidez humana. Entonces eso me parece un detonador así como central. He visto también en mi investigación sobre el tema que, bueno, el Producto Interno Bruto que genera la mujer que cuida, o bueno, no solo la mujer, bueno, hay también hombres que cuidan, ¿no? Bueno, las personas de cuidado también desarrollamos, bueno, el Producto Interno Bruto que cedemos al Estado con este trabajo que no es reconocido, que no es pagado, también me parece como, no sé si esté considerado, pero como que es demasiado alto como para que pudiese subsidiar también necesidades básicas de las personas que generan cuidado. Por ejemplo, las personas que se encargan de una persona enferma, pues conlleva mucho desgaste emocional, psicológico, y las personas que cuidan no tienen este cuidado garantizado. Por ejemplo, servicios de, no sé, por ejemplo, transporte, ¿no? Como al no tener un ingreso, pues no tienen servicios de transporte tampoco garantizados. O no tiene, o por ejemplo, actividades deportivas o actividades lúdicas que le permiten de alguna forma en ciertos tiempos de su día a lo mejor tener esta calidad de, bueno, acceso a distintas actividades que le permitan manejar su calidad de vida. en pocas palabras, y ya para no alargar tanto mi participación, está contemplado un desarrollo personal, pero primero porque veo del Estado, veo de las empresas, que sí se está proyectando, pero bueno, desde la perspectiva del individuo, ¿no? ¿Qué políticas se pueden adoptar para que el individuo acceda a servicios, a lo mejor sí proporcionado por el Estado, pero si estas personas deciden no dejar de no continuar con los cuidados, pero a la vez puedan tener acceso a ciertos beneficios como parte de los trabajadores del Estado, porque finalmente también nos volvemos trabajadores del Estado.
Mónica, ¿me escuchan?
Uh-huh.
Muchas gracias por tu participación. I will translate, un poco resumido. Mónica, she is studying a bachelor's in communication and is working around the subject of the law for the national system of care. And she is asking her, firstly, if you, in the context that your work in Deepta, have carried out analysis about the profiles of the women who give care, what kinds of needs they have, also differentiating between women who care through maternity, other ways of caring, women who do this whilst they are doing also paid work, different profiles. And also a big question that Monica has is that as she reads around the national care system and the debates around care systems, it seems to her that the persons are somehow put to the side, and now that it is only about the state, that the state is to assume all the care, and she is asking herself if there is alternative agendas and where the persons and the nexus of solidarity that marks care is within the debates around care policies. And just to I will give some examples, of course. Thank you. Yes, so she is asking what kinds of support systems can we talk about in care systems for the persons who give care and who need care. So, for example, access to transport, access to some kinds of pensions, whatever. No, so what is this tapestry of the national care system? And just to make justice to the discussion or conversation that is coming into a dynamic here, Mongolia in the chat is saying that responding a bit and dialoguing with what Monica has said, is that it is important to be careful about the interpretation around care systems. No one is saying that the state is supposed to be the only one who cares. What is asked for in the debate around care systems is that families, the state, the private sector, and communities assume co-responsibility.
Yes, absolutely, and thank you, Mongolia, for raising that point, because it is about, like, so if we have to have a care system, it has to be that diamond. It has to be these four different institutional actors assuming co-responsibility, which exactly doesn't mean that the state is doing everything, but the state has a major role to play. So I think that, and I'll come to your first point a little bit later. But I think, and on this point, I think the issue is that you're right that that if the state has to build these systems, then we do need, which is why we need these qualitative profiles, right? We need an estimation of what, or an assessment of what women need or which women need what, right? And which persons need what care as well. So yeah, I mean, if for example you have a and this was talked about in a workshop that I went to on the UNOHCR resolution on care and support. And you know, it's not enough, for example, to have a center for people with disability where they can be not just cared for, but perhaps they can learn something or do something, etc., right? But what happens to people who can't even leave their house, right? Because like, so I think that if and so there are two aspects here. One, the care system needs to provide transport for this disabled person to go to school or wherever. The second, mm, is to have a is to have some form of support for the people who can't move out. So you can, so there could be, for example, paid care workers who come into the community. Now, there are examples of both of these aspects that have happened, specifically with the persons with disability, and but also in terms of health, right? So again, healthcare centers, but also providing outreach workers for health, again irrigation or agriculture. Like it's the same, like we need to kind of think about all of the roles that women do, and what their lives encompass. And it isn't their lives are not divisible. Like it's not like, okay, now you're doing this, now you're doing that. It's not like that. Like nobody's life, not men's, not women's, not any genders. So I think it's really about thinking about uh, you know uh, the national care systems taking into account, which is why it is about both the care providers and the care recipients. And that's why not one intervention cannot help. You can't just give a cash transfer. For, let's say, in Kenya, in Nairobi, there was a program of, like, testing out cash transfers for women to access childcare services. Now, that's fair and fine because these were private childcare centers, but it created two problems. One, it was a sort of like an RCT where you know you would get a voucher and I wouldn't, because it's computer generated, right? So you would get those vouchers and I'm not getting those vouchers. So it creates problem in the community, going like, why is my care less valued than hers, right? The other problem was the childcare centers themselves. Like women said, that if they're not good quality, we're not going to send the children. And plus, how are we going to get to that childcare center? You've given us voucher for paying the fees of the childcare center, but I will need to miss 2 hours of work to get the child to the childcare center and pay transport, because it's not safe. For example, in public, many places public transports are not safe for women. What do you do? So it everything has to be, which is why I think I was really, like, kind of like talking about this, which is, let me just, sorry, 1 second, which is about the paradigm, the system, which is this, right? So it has to be the care infrastructure, there's care related social protection, there's care services, and there's employment related policies. And I agree with you, Jana. I mean, in fact, I didn't answer that point. A lot of people are based in the informal sector. You can't have parental leave because who's going to give it? Or domestic workers, how are you going to do that, right? But there needs to be sort of like employment related care policies, in the sense that so there are pilots of very very small amounts, but there are still pilots of, let's say, like giving cash transfers to pregnant women for 2 months, that um, you know covers their maternity time, right? But that amount is so little that in fact women don't, like, they don't stay at home. But that we could think of a situation where that amount is enough for them to actually have this leave. Or if they're caring for a disabled person, there are grants in South Africa, for example. I know there are childcare grants, but there's also grants for looking after disabled people, because it recognizes then, but it not just recognizes, it actually, so it's in that sense that the state fits in, but the market also has to kind of like contribute, because if you have like hard arduous work, then you are still going towards depletion of women's physical and men's, right? And this is something that we found, that poor men work very, very hard. Like they are. It's not like they are not working and they're just kind of like leaving the woman to care. They work very hard as well, like like these daily laborers or seasonal agricultural workers, etc. Coming to your first point about, yes, we've carried out analysis of different women, different profiles. Um, I can actually pull that up in a minute. If give me 1 second, because do we have just see if I can find the. There we go. Okay, so this is so. I mean, I can pass this website. Okay, so for example, we've got these. So we had 126 case studies of each. So each of these is one case study, right? So from India, Nepal, Rwanda, and Tanzania. So if I look at this one, for example, there are profiles where you have the age, what are their care responsibilities, and her story in her it's not written by her, obviously it's not even spoken by her, but it's kind of like in like long interviews, and then the researchers have written that and cross-checked with her. And again, we've got there should also be a like a time use sort of thing, which is not working here, but this is sort of like, but just to give you an example of profiles that we do have these profiles, which is from the Grow project. But there are other, like, even in this project, we are planning to make profiles of types of different care responsibilities. So yeah, so there's some work on that.
Okay, thank you.
Thank you very much for the specifications. Gabriela, thank you. Monica, thank you for your question. Our time is up. We had a little bit of technical problems in the beginning, so a few minutes less, but it's just the beginning.
Anyone else who wants to ask a quick question?
I think there was no more questions. I don't know. Is there a question? No. So this is a beginning of a conversation. We have seen that we have a lot to learn from each other, huge challenges. To the question that Monica was saying, I would maybe just want to add that in societies such as Latin America and Mexico, mainly, where families carry the whole load of having to resolve everything, all the care needs, and within these families, very often it tends to be more women. The care agenda is about having alternatives, no? So that we have wider spaces of decision. If we want to care for a time in our lives, being a man, a woman, or whoever the person is, that the person can do that in just conditions and not at the cost of himself. And all this really implies, I would say, a huge social revolution and a very active state of the role of the state. So that is something that we are debating, I think, and we are just in the beginning. It will be a long-term effort. And I do think what you were asking about spaces also of personal support, that in Mexico City even, we have really interesting examples. For example, the government of Iztapalapa has instituted utopias. I don't know if you have heard about this. I will say it also for Deepta, which are really spaces of community care where persons on the biggest alcaldía delegation of Mexico City, that is very precarized, lots of people who live in informal working conditions, can access a dignified space for spending time, for having access to integral care, even for working with addictions without a punitive context, and also some initiatives that start to work towards the redistribution of care. For example, access for caregivers to different spaces for reconnecting with themselves, for self-care, infrastructure such as washing machines in a part of the city where we have no access to water. So I do think that a lot of things practically are happening, and it is really important what the state is pushing for, but also there's a lot of social organization around care, and also between caregivers. The same initiative that I am part of, Yo Cuido, is an initiative of unpaid care workers who organize to support themselves between each other, um, to have a support network, because many stay alone. Also, they are abandoned by family. And they are looking for collective solutions, for example, for collaborative living together, where they can take care of each other and also redistribute care between themselves at the same time of seeking care services through care cooperatives. So I think a lot is happening, and there is hope, even though it all seems sometimes very bleak because the structural challenges are huge.
Gracias. Sí, estoy consciente que hay en la Ciudad de México alternativas. Sin embargo, sí considero que las personas de cuidado en particular atraviesan por procesos muy difíciles. Sobre todo, bueno, sí, bueno, en el cuidado, hablando por ejemplo del cuidado de los hijos, pues bueno, sí, pero sabemos que es como temporal, ¿no? Porque vayan a llegar a una edad en la que van a ser independientes. Pero en cuanto a los procesos de cuidado, por ejemplo, de personas con algún problema de salud, esos cuidados se prolongan indeterminadamente, porque bueno, hay casos, ¿no? Obviamente, pero bueno. Entonces, el, lo que me parece esencial es la conciencia de las mujeres en el autocuidado. En el primero me cuido a mí para estar bien y después cuido al otro, ¿no? Me parece que ahí las mujeres en general, bueno, en términos generales, aunque bueno, no se puede generalizar, sí falta ese trabajo, esa contención psicológica y emocional de la que les preguntaba yo, porque muchas veces no somos conscientes de esto, de que si estoy bien puedo cuidar, pero si no, me puedo de alguna forma es difícil atravesar estos procesos de cuidado si no estoy bien yo, tanto emocional como psicológicamente. Y las mujeres en sí, en México, me parece también que es un problema también en Latinoamérica, es que no somos conscientes de eso, ¿no? Como que te enseñan a que primero das y luego, si hay tiempo, te cuidas, y si no, pues no te cuidas. Y también, bueno, una vez que ya está inmersa la mujer en el sistema de cuidados y, por ejemplo, pasan cosas como que los hijos crecen o que la persona a la que cuida ya no está, se va gestando ese vacío, ¿no? De, bueno, ¿y ahora qué hago con mi vida? Entonces, bueno, son como distintas etapas también dentro de esto. No es lo mismo cuidar como te digo, a un hijo que a lo mejor a un hijo que tiene alguna discapacidad permanente o a tus papás, ¿no? O sea, como, y bueno, en este sentido sí hablaba más como yo de el fortalecimiento personal, el autocuidado, y de alguna manera, qué opciones tienen las mujeres para salir de esto una vez que esas etapas terminan, porque al final terminan, ¿no? Bueno, perdón, quiero cambiar. No mujeres, porque también hay hombres que cuidan, perdón, no nada más las mujeres.
Gracias, Monica. I'll translate. Monica was referring also in her comment, made a stronger emphasis that what moves her is finding out what kinds of spaces and what are the strategies possible to also support caregivers, mostly women. She emphasizes that also there's full-time caregivers who are men, or caregivers who have strong care loads who are men. And if there are spaces that support these persons emotionally also, because definitely part of the root is building consciousness and learning to also think about yourself and to rebuild maybe your project of life after decades of taking care, especially because childcare is care during a certain period of time, but then there's long-term care, which is a whole other story, and that is what she is referring to. I would also like to tell you something, but first we'll pass on to Deepta.
No, I just want to say yes, thank you so much. And I think to raise that emotional support issue is really, really important. And which is why we talk about, like, when I say depletion, I don't mean just depletion of like women's physical capacities, but also their emotional capacities. Like, women are tired. Most women that I talk to who are in these low income families and low paying jobs, informal sector jobs, etc., they are very, very tired, emotionally tired, not physically. Physically also, but like they are exhausted, they're like mentally stressed out. They're not living that. And I think that it's really important, like you say, to kind of rebuild and build your own consciousness, but also then have those options, like you say, Anna, like those options to kind of say, okay, I have a way out. But if they don't see that's actually really, really important, which is what collectivization gives them, is to share sorrows. And I think that's a really important part of like building sort of a collective political um, identity. Thank you.
Thank you. Yes, and just to answer really briefly and to share really briefly, but because what you are mentioning I think is really important, that is part of the work of collectives such as Yo Cuido, between unpaid care workers, the group, the collective, and the movement where I collaborate in. It is unpaid caregivers, women mainly, who give care to many persons within their household, some in their communities, not only to children, to persons with disability, with long-term disease, after decades of having done this work and forgotten about themselves, where they come together to support each other and to remember that they exist again. And through an auto-organizational process, um, we also came to a moment where we sought for the participants of this network psychological support. They are working together on collaborative entrepreneurship initiatives where they find again a way, a project of life, and a way of sustaining themselves economically also, but not in an individual manner, in a collaborative manner with others who are in the same situation. Because what happens often, if we go to spaces where there's different kinds of persons who do not give intensive and extensive care, again, these voices are silenced and the overload is so huge. You don't have time. The spaces are not designed that you can participate. So I do think that there's a long way to go also to support these initiatives. And coming back that we are in an academic space, I think that the academic sphere can also do a lot in supporting these initiatives, and also of pushing, for example, what you say, psychological services specifically for caregivers. There's such a huge need for that. So thank you for sharing.
Thank you.
I don't know if there's another question. I think no? Okay. Well, thank you very much to Deepta, to Aisha for having made the way all the way here, and to everyone for having joined us in person and also online. Thank you.